My name is Dr. Sophia Davis. I'm the foot and ankle surgeon at Orlando Orthopedic Center, and today I'm going to talk about ankle arthritis. For people that have end-stage ankle arthritis, there's really two treatments, either ankle fusion or ankle replacement. Ankle fusion has typically been the gold standard for treatment of ankle arthritis because we've done it for years and years, and people actually do very, very well with this. Believe it or not, all your ankle motion does not come from your ankle joint. A lot of it comes from your midfoot joints, and you will still have some ability to move what you perceive as your ankle up and down even after ankle fusion surgery. That being said, we are doing much better with ankle joint replacement, and we're doing more and more of these, and people are doing well with these too. An ankle joint replacement advantage of it is that you don't lose the motion in your ankle joint, and whenever you fuse one joint, you end up developing a little bit of arthritis in some of your other joints around it. So if you did an ankle replacement, you don't get that same surrounding joint arthritis. As far as recovery from these two surgeries, ankle fusion, you would be placed in a splint immediately after surgery and then into a walking boot, but you would be kept non-weight bearing for approximately 6 weeks to 8 weeks, depending on how the fusion was going. With an ankle replacement, you would be placed in the splint after surgery and basically kept in the splint until the anterior wound healed. Once the wound was healed, you'd be placed in a walking boot, allowed to weight bear as tolerated, and start your motion.